I studied in Usmania Medical College in Hyderabad. For my post-graduation, I went to United States. I did my residency. At that time, I also built a multi-billion-dollar edtech business, bootstrapping. I stayed there for 25 years. Came back to India a year ago, in a year and 3 months. Contested elections, won with one of the highest majority. And I was offered MOS, Minister of State in Telecommunications and Rural Development. So, for the last 25 years, I worked in numerous hospitals. I used some of these products, including eClinical Works in US hospitals. And I taught as a faculty for a lot of medical students and residents. And I have a deep experience in building a world-class product with world-class people. And I was quite successful. So with that experience, because Dandikarji asked me to give this speech, and I thought I would be a right person to talk because I have both true experience of both healthcare and after coming here for the last 1 year, I have been deeply involved in 2G, 3G, 4G, 5G and 6G. So I have a good understanding of that. But anyway, it's a privilege and an honor to address all of the intellectual people who are sitting here to reflect on a decade of digital transformation that truly reshaped India's future. And we always must give this credit to our Honorable Visionary Prime Minister Sri Narendra Modi ji, who has transformed India from digital dependence to digital dominance over a period of decade. What once thought to be aspirational now has become foundational. And the heartbeat of this foundation is connectivity, as you all know. Connectivity, if you look at it, over the last 11 years, more than 95% of India is now connected with 4G, including a lot of remote villages. There are only approximately 30,000 villages that do not have either 3G or 4G, which we are connecting now. These are the areas that are forest areas, hilly areas, where you don't even have a road access. And we have the largest mobile network, almost 1.2 billion subscribers. So literally every human being in India has a mobile phone. And we have the cheapest data rates compared to the rest of the world. And we have wide array of mobile phones that are from 2,000 to 1 lakh, expensive ones. And we have also launched 5G, and this was the world's fastest rollout. More than 80% of Indian population, if they have a handset that is 5G compatible, they can latch onto it. Currently, 25 crore people are using 5G in India. Still a long way to go, but that is happening rather faster. With all of this, we have also connected close to 2,14,000 villages with high-speed fiber optic cable. These BharatNet 1 and 2 projects that have started for several years ago have achieved this 7 lakh kilometers of optical fiber. But due to various reasons, because there is so much development happening, highway construction, a lot of industrial projects, there were numerous cable cuts and interruptions. Therefore, we have released BharatNet 3 project with 1,30,000 crores approximately, close to 17 to 18 billion US dollars. The goal of this is to connect another 40,000 unconnected Gram Panchayats. That is number one. Number two, to go back and look at all the cable of these 2,15,000 villages, how we have done, repair and maintain for the next 10 years. And number 3, to bring close to 1.5 crore rural households into this high-speed internet by giving subsidies and incentives. So there is no upfront cost. So these are the things that the Department of Telecom under Modi ji government has been doing to connect every village, every person, regardless of where they stay. In addition to these, we have also given permissions to licenses to Starlink and other satellite companies so that they can connect even the few unconnected spots that traditional terrestrial networks are hard to reach because of the road access issues. So this is all not just about faster data, it is about faster development, whether it is for education, governance, and most importantly, to heal the nations with appropriate healthcare. This is one aspect of the telecom. The other aspect is the healthcare. If you look at India over the last 10 years, 11 years, under Modi ji's regime, even healthcare has significantly improved. If you look at Ayushman Bharat, it's probably the world's largest health assurance scheme. We have more than 9 crore cashless treatments. 1.25 lakh crore money has been spent on this. And the result is, it used to be 62% of out-of-pocket cost consumers has reduced to today 39.4%. So almost close to 40% reduction in out-of-pocket expenses, especially for rural people. And then we have also started working on 1.5 lakh Ayushman Arogya Mandirs. These are primary health centers that were established. And the other big challenge was the number of doctors, nurses, and paramedical people. So over the last 11 years, the MBBS seats were up 112%. Today, we're graduating more than 1 lakh physicians. PG seats were up 127%. Now it's more than 70,000 specialty doctors are available. And if you combine both allopathic and Ayush doctors, we now have close to 19 lakh doctors. But even if you take allopathic, it's 13 lakh physicians are available all over India. And now this stands in combination, the patient to doctor population, doctor to patient population will become 1:834 when you combine. Even when you consider only allopathic doctors, it comes around 1 to 1,500. So the World Health Organization optimal number is 1 to 1,000. So we are close to WHO requirements, and as earlier that Dandekar ji has explained, we have revolutionized the access with e-Sanjeevani. There are 36 crore teleconsultations. On a peak day, almost 500,000, 500,000. So these are the real solutions that doctors are able to solve with the digital networks. And the other big initiative that we have taken is under Ayushman Bharat Digital Mission, close to 55 crore health records are digitized. And there is a Telemanas where you can get 24/7 mental health counseling through various languages. And what was an experimental app, UWIN, during the COVID, now turned into a universal digital immunization tracking app. So all of these are the remarkable achievements that were done over the last 10 years. India is a large country, much diverse. We have various spectrum of people, wealth inequalities are there. So there are still a lot more challenges, and we understand all those challenges. And this is where the industry the government, passionate, driven entrepreneurs and citizens in combination can solve a lot of these problems. With my expertise, I see now, even though I was there 25 years now, after seeing here, going to different villages and working with a lot of people, now I understand how we can solve a lot of these problems. So this is where I believe certain solutions are there. If any of you are entrepreneurs, are interested in solving some of these, there is a huge opportunity. So if you take the rural access issue, 60% Indians are still living in rural communities, but the doctor, even though we have the patient to doctor population is close to optimal, the distribution inequality is there. So the population lives 60 to 65% in rural, but the doctors are around 65 to 70% are staying in urban places. This is where high-speed connectivity like 5G or our BharatNet working well can solve a lot of telemedicine. Through telemedicine, a lot of those access issues. And then drone delivery of medications. We do have drones. We're using for pesticides. We're using for chemicals and a lot of other reasons. But this could be drone delivery of essential medical supplies, emergency supplies, could be a good business opportunity if it can be branded, nationalized, and solved, systematically. So there should be one brand where, emergency medical equipment and medication delivery around India. That is something one can solve that. And then specialist distribution. This is again supply and demand story. So obviously as the supply increases, even some of the doctors are forced to go to rural places. But this is where an innovative solutions can solve. I would consider any parliament segment. If I have to start the business again, if I am not in the government, probably I can take up this business and build it into a multi-billion-dollar one. One I see where you take a parliament segment, one large multi-specialty hospital, you can build it. And in every village where you have more than 500,000 population, you can build a small 100 square feet building, small one, branded. You take all the nurses that are training in that area, in that parliament region through the nursing schools. You build the capacity, build them with world-class knowledge, rigorous testing, and you make them empowered close to, if you look at US and all these places, there are a lot of nurse practitioners. They are so well trained, they replace a lot of the doctors also. And nurses are inherently equipped with some of the medical knowledge. You can capacity build these nurses and deploy in every small area. You build, 10 mobile vans. These mobile vans are equipped with these either MBBS or MD trained physician with all the emergency equipment. And you take insurance from all those rural people, minimal charge, 100 or 150 or 200, whatever that is, minimal. And you provide them end-to-end solution. So if you have any small area, you go to the local nurse and a mobile physician van will come if there is a next level one or a nurse can solve. And from there, you also install a defibrillator, basic stuff in those village areas, basic blood testing, and even if you need a small ATM machine where you can give CBC, BMP, basic blood test. Like that, by involving the village people, by building the trust, by avoiding the long delays, and by providing an effective primary care, you can build an effective system. And it is possible, obviously with a little bit of government support, little bit of, our patients being involved into this, and the central government Ayushman Bharat scheme. If you combine all of these, I think you can build an effective solution that will reduce healthcare costs, specialist fix the specialist distribution and rural access areas. And the fragmented records, e-clinical works. There is an advantage and disadvantage for India. In US, one big problem was actually having multiple medical records. It started very early, multiple private organizations took that responsibility, and each one built a very effective healthcare record system. But none of those used to interoperate. Nobody would communicate. In the way in US, if a person goes from one hospital to another, or if there is an emergency, you would do all different testing again and again. The reason was most of the patients who use the resources are the people who have chronic problems, whether it is heart failure or it is COPD, lung disease, or they are on dialysis, heart failure. These kind of people will have a lot of emergencies, and emergencies will take the patient to the nearest hospital rather than their chosen hospital. So the healthcare cost was increasing. And also a lot of these healthcare records, EMR, were built by technology people rather than really involving the physicians to the core. So it created a lot of usability issues and putting thresholds too sensitive, alarm fatigue. There were numerous problems. So healthcare records, instead of, they were helping, there is no doubt about it, they were helping, but they were not optimal. India being a little bit behind in this process, a truly centralized electronic medical record, obviously being built by government, under Ayushman, digital mission. If we can build that in an effective way, it would solve a lot of these problems. A lot of the private entrepreneurs can build. The one dreaded thing is writing a prescription that no one can understand other than that physicians, local pharmacists, is something that people know. A lot of drug errors happen. People lose lives. So electronic prescription is another whole thing in India that can be developed, that can be integrated with the government institute, whatever the records we are building. So that itself is another opportunity, listing all the pharmaceutical drugs, price comparison models, bringing transparency. And not only that, and we have a lot of fake drugs, generic drugs that have low quality medicine. Verifying these pharmacies, e-verifying, these are all things can be taken by private entrepreneurs. So this is how you think about as a prescription or pharma business, one whole entity, you build it and you integrate with the rest of them. So you are helping everybody, especially the public. So that's another one. And the other major issue is preventive healthcare. The preventive healthcare is a huge burden, especially with all the smartphones and TVs, people sitting and not moving. You see diabetic, hypertension, heart disease, all these epidemics are increasing. So how can we build something for a preventive in a large scale? This is again through the mobile clinics, you can do a lot of preventive care. The way you do dental clinics, you can go to village, dental hygiene, you go to every school. At school level, you have to screen them for hearing loss, eyesight, all of these at the basic level. You put mobile mammograms, mobile pap smears, and vaccination. All you need is a refrigerator with all the vaccine. You go on a saturation mode. The entire preventive care can be done along those lines. So the universal vaccination can be achieved. And basic primary care can do a lot of preventive, routine blood pressure checks, HbA1c, like the basic stuff, vitamin deficiencies. That itself can be part of a holistic healthcare or the state-sponsored one. And we have language barriers. There is another opportunity where someone can build a real-time translation. Because we have numerous languages and dialects, so that itself could be a translation with a focus on medical terminology. A lot of these translational services are for generic knowledge. But if you focus on the medical knowledge and you sell it, that could be a valuable one as well. So overall, these are some of the solutions. And we all talk about Viksit Bharat, how India can be like the rest of the world. And every citizen in India deserves a medical care that is at the global standards. And you look at all the different models, whether it is United States or other developed countries, whether it is Sweden, Switzerland, Japan, all these people were successful due to various reasons. They created a holistic systems. Even though US, money spending is not the only solution. In US, if you look at it, 17% of the GDP comes from the healthcare. The only advantage, but the mortality and outcomes are not that great when US compared to other countries that spend less amount of money. But there are some things that does US and other countries does really well, which we could take from. For example, home-based healthcare services are not there in our country. Again, these are the nurses that can go home. These are skilled nurses that can deliver services at home. We need to provide occupational therapy. Occupational therapy is not a concept in India. And then hospice services, palliative care, we don't have that. That can be completely implemented. And another one is case coordination. Because if you look at large hospitals in the country, all these people who have very low literacy don't know where to go. Obviously, their financial system may not support. But if you build social workers or case coordinator, care coordinators, these people can identify all the community resources, all the people who are willing to chip in, and connecting them can create a lot of value. And mental health services, even though we are going through the telehealth, there is still a lot more we need to do. These include regular mental health counseling, marriage counseling. There are a lot of these school-based mental health services. The reason why these are important is if you develop all these services, one, you serve everyone. Second, it creates a lot of employment to the country. We are a country with a lot of young population. Not everyone can become an engineer and doctor. Not everyone can get a job in America, Australia, or Dubai. We need to take care of our own people. The best way to do it is actually to capacity build for the entire healthcare. Some people may go to different countries, but many of you will stay here, remain here. But when you need those services, these are all the things, holistic services that are needed for everybody. So, and the countries also looked at, how they did a lot of this, how they were able to build it. Though we have some limitations, I believe investment in primary and preventive care, price controls and cost transparency by grading the hospitals and facilities and giving some price controls. And obviously we're building the good digital infrastructure, which I've been doing. And also workforce planning. The workforce planning should be at the state level based on their needs rather than just creating and training all these people who are not going to have jobs. In spite of all this stuff, as I said earlier, we still have to go to a lot of villages that needs high quality connections, not 3G, 4G, they need 5G. High-speed fiber are probably going to be 6G so that these telemedicine interviews would not be interrupted. And then we have some areas still power and issues, those need to be solved. And there is a upfront cost, how we are going to solve these, and mindset issues are there. But these are all the challenges, but that is, India is a large country. We should be the living laboratory for the world. And if starting the things delayed has a little bit advantage because we can see how the rest of the world is doing and we can build it. Really high quality, scalable solutions. And I hope all the participants, as I said, the whole of a society approach, whether it is industry, entrepreneurs, government, and everyone can make this process more successful so that no Indian should never be out of network either digitally or medically, because every Indian deserves a high quality international healthcare. So with that, I thank you everyone and I wish you good luck for all the interesting and intellectual symposium or discussions that are going to happen. Once again, thank you.